I'm a medical doctor who helps in screening COVID cases using PCR and RTK antigen method. My team and I are familiar and competent with protecting ourselves and minimizing our risk of catching COVID in our line of work. We also help the government to give vaccines to patients. We have heard stories about people getting COVID infections after the first and even after completing 2 doses of COVID vaccination, be it Pfizer or Sinovac. I also checked my own COVID antibody levels and found that my body did respond, but the level was not as high as expected 4 months down the road when I completed my second dose of Pfizer vaccine on 12 April 21. I knew by then that vaccination alone could not protect me 100%, and I was very vigilant and careful at my workplace. I'm also selective of the patients I see. I don't see patients with recent fever or symptoms suspicious of COVID. I do teleconsultation for such cases most of the time. However, outside my clinic, I am sure like many of you, I have to buy food and groceries. Even when I eat out, I would avoid crowded restaurants and choose one with good ventilation. I only ate with my wife and when we had to eat out. Only during eating time, we removed our mask. I must say that I have been very careful not to risk getting COVID, even though the government is doing the opposite by opening up more sectors to stimulate our ailing economy and considering opening schools as they are very positive of their ramp-up vaccination effort. And yet, I still come down with COVID. Do you think anybody will be spared in this wave of COVID? When the pandemic just started in early 2020, I was thinking to myself what to do if I'm to avoid COVID. But as Malaysia was being attacked by this deadly virus more aggressively since the Sabah state election in September 2020, I began to think about what will I do when I get COVID. So I'm very fortunate to be part of a group of like-minded doctors in West Malaysia who takes a proactive step in managing category 1 and 2 COVID patients appropriately instead of passively waiting for them to advance to more serious COVID of category 3, 4 and 5, then only hurry them to the hospital. As our hospitals are still struggling to manage COVID patients, we have to try our best to prevent people from needing hospital care now. If you become very ill COVID case and end up in the hospital, there is very little the doctors can do to help you. They can only watch you and hope for the best. So I will be showing you how I cared for myself and for my COVID patients when we were undergoing home quarantine until we recover from COVID-19.